Aloha, my name is Jennifer Andrea, owner of Ho'ana Wellness. I'm a certified women's empowerment coach and a licensed massage therapist with a specialization in lymphatic health and breast wellness. It is my mission to empower women in cultivating self-love and to offer a fresh, natural approach in how we care for our mind and body in promoting breast wellness. Aloha, I'm Jennifer Andrea of Ho'ana Wellness, and today is part 3 of lymphatic health and your breasts. So I'm going to teach you today a very simple self-care technique that you can use to incorporate into your daily beauty care routine. So if you didn't get a chance to see video 1, which was the theory of breast massage and what it is and why it's important, and then video 2, which was the benefits of breast massage, I highly recommend that you go and check those out before watching this. But today you are going to learn a wonderful technique that you can use in your day-to-day beauty care routine. Okay, so first I just want to say that if you are an individual who has active cancer or an undiagnosed lump, please seek a physician. This technique is not for you. If you are an individual who has gone through a life-saving or cosmetic breast surgery, the techniques can be applicable, but I highly recommend seeking out a trained therapist that can assist you with your specific needs. So I'm going to start with the technique. It's important to know that the lymphatic touch is a lot lighter than what most people may perceive. So this is not generally a massage, but you can incorporate some massage into the breast work. But what I'm going to teach you today first is just the lymphatic touch. So the lymphatic touch is a very light touch. So think about how it feels if you were petting a cat. So it's just a very kind of feather-like touch on the skin. So you can kind of see how this looks as I'm touching my forearm here. It's like I'm petting a cat, you know, very light. Or think of it as like the weight of a nickel lying on top of the skin and how light that would feel. Because your lymphatic system lies right underneath the skin. So any deeper, you're actually bypassing the system. You're getting into fascia and muscle. So we want to do a very light touch. Some of the areas that you'll touch though in this technique, you will go a little deeper because that's where the lymph nodes reside. So you will be applying a little bit more pressure. But generally try and keep in mind the lightness of the touch. It's very subtle and you know, it's a very relaxing technique. So first we're going to start by placing your fingers underneath your ears, kind of at the top of the neck here. And we're going to, all of these techniques you can do like 5 to 10 times, but just for purposes of today's video, I will probably just show you like 2 or 3 times. So we can kind of go through the whole segment. So again, starting right kind of here at the top of the neck, kind of where like the tonsil area would be, you're going to do very light strokes coming down to the collarbone. So right here where your collarbone is, if you kind of shrug your shoulders, there's like a hollow behind the collarbone. That's called your subclavicular fossa. This is where the circulatory and lymphatic system rejoin. So this is very important in kind of opening up the lymphatic system before we do the other work that we're going to do here. So it's kind of like basically we're working on the peripheral areas of the breast, and the breast will actually get to last. Okay, so you're going to do a very this one you can actually go a little bit deeper because you know, for some people you may have to kind of shrug the shoulders to kind of get in there. So it's a very light touch again though, and you're going to start kind of medial here at the sternum, and you're gonna go in the direction, basically think of like 2 arrows pointing that way. So you're going towards the sternum, but you're starting here at the notch of the collarbone, and then we're gonna work out. So we're gonna go in, in, in. So again, we wanna do this about 5 to 10 times, but I'll show you with kind of like 2 or 3 strokes here, okay? So we're gonna go in the direction of the sternum, go in the direction of the sternum, and then go in the direction of the sternum. So you can do this again, you know, 5 to 10 times, and kind of as you're doing it, you know, shrug the shoulders so you can kind of get in there a little bit more, as this is where some of the deeper lymph nodes reside. And then you're going to lift your left arm above the head here. And it's probably best if you're actually lying on a bed and relaxed in a relaxed state, because just, doing the technique like this can get a little cumbersome. So I usually recommend women, relaxed after, a shower in the evening, they're clean, the body's clean, and, to be able to do the technique. Because you also want to perhaps apply like a nice oil too, because the oil does give more fluidity on the skin tissue. So again, you're going to put the arm kind of at shoulder height there, and you're going to use the palms, or excuse me, the kind of the paddy part, of the fingers, of the 3 middle fingers here, into what would be considered like the hairiest part of the armpit. So it's kind of that kind of hollow here in the underarm area. And then we're going to do circular motions. So we're going to go up and out. So I see it as like superior lateral. So superior lateral. It's up and out, up and out. And you can kind of work into that middle part of the underarm area there, because you're just pumping the lymph. This is your axillary node, so this is really important for the whole upper body region of your lymphatic system. It's a main drainage site. That's why we use deodorant here, antiperspirant. This is where we detox. So this is very important in stimulating the lymph nodes here to receive the drainage from the breast area, which we'll do shortly. Okay. And then we're going to go to the breast area. So I'm going to show you, I guess it'll be about 4 techniques. And the first one is the alternating horizontal, is what I call it. So you're going to place your left hand underneath the breast, your right hand over the breast, and then you're just going to go back and forth, back and forth, back and forth. So it's alternating horizontal, because it's alternating techniques of the hands. And then next we're going to do what's called a sun ray. So we're actually going to place the hand over, kind of around the areola, which is the darker area surrounding the nipple, over the breast. And then you're going to kind of do, think of like the rays of a sun, and it's just going to go over the surface area of the breast. So about 75% of your lymph goes to the underarm area, and the rest go towards the neck and then towards the liver area, the sternochyli, which is part of your lymphatic system. So we're going to do the sun ray, and you can kind of move your hands so that you make sure that you get all the surface area of the breast. And then we're going to do like a jiggling motion. So think of like a figure 8 over the breast, and then just jiggle it, because you want to just get that circulation movement into the breast tissue. So either figure 8s or jiggling. And then we'll finish with kind of a lift and compress of the breast, kind of lift and compress. And then think of a nice wave-like motion that goes towards the underarm. So again, we're moving all that lymph to where it's going to drain there. So lift, compress, and then towards the underarm. And that's really, really beneficial for what's called the retromammary space, which is where the deeper lymphatics lie in the breast. So we kind of want to help release some of that. So again, it's alternating horizontal, sun ray, a figure 8 with a little bit of jiggling. So you're actually just, if you're using oil, you can actually get more fluidity within the breast. And then the lift, compress, and then move all that towards the underarm. So it's a nice like wave-like motion. And then we want to go back to the axillary node. And so we're going to repeat everything we've just done. Go back to the axillary node and do your circular motions 5 to 15 times. And then we'll go back to the hollow here of the collarbone and go in the direction again of the sternum. And then you can do the nice strokes down the neck. And then we'll repeat that on the right side. So the main thing to remember here on the right side is that you're going to go counterclockwise. So basically, you just remember it's up and out. So with the left side, it's clockwise. With the right side, it's counterclockwise. And think of that as you're sitting in your own position, not as you're looking at me. So it's kind of like that, I guess. You could see that as 2 arrows going outward, up and out. And I do have this information on my website, and I'll, so you'll be able to link to that and get a PDF if you need more assistance. So hopefully that has been helpful to you. And it's what I want to really just stress is that we take care of our nails, we take care of our hair, we get our pedicures. But what about our breasts? And this is something that we can do daily. Usually it's recommended, breast massage can be done daily, but it's usually recommended like 2 to 3 times a week. And can be done like after you get out of the shower, or maybe when you're in the shower, or just at the end of the day when you're relaxing, to incorporate into your beauty care routine, because these are our girls and we got to take care of them. Okay, well, thank you so much. And the next segment, and stay tuned, I'm going to be talking about emotions and your breast health. So that will be the next video coming up. Have a wonderful day. Thanks for visiting Ho'ano Wellness. For more information, you can visit ho'ano.com or join me at Facebook at Jennifer Andrea.